Okay, everyone. I know that we're going live, and I just want to give everyone a moment to fully connect with us before we begin. But just to say how much I appreciate folks joining us tonight. It's going to be an important discussion, and I think a very informative discussion for everyone joining us. And so while all the streams are connecting, I just want to take a moment before we begin to acknowledge that all of us who are tuning in tonight are on traditional Indigenous land. I'm on the treaty lands of the Mississaugas of the Credit First Nation. And I want to, one, express my gratitude for the opportunity to meet on this land and for the teachings I've learned from Indigenous peoples, particularly about the importance of how we care for each other and how we care for the earth, and to also just express how important it is, especially through the truth and reconciliation process, to heal our relationships with each other and with the earth. And I also want to say that, you know, given just the tragic discoveries of so many unmarked graves of Indigenous children who were stolen from their families to go to residential schools, just how vital it is that one, we find those children, and two, we provide justice for Indigenous peoples, and especially those families who lost their loved ones in residential schools. And so maybe everyone can just take a moment to reflect on what role you can play as part of the truth and reconciliation process.
And Mike, I am in Treaty 13. Just so you know, which is
Mississaugas of the Credit. Exactly.
That's where I live. And one of the churches next to us has, of course, all the little shoes. And every time we go in the evening with my husband to a break, we stop there. And it's unfathomable that in this borrowed nation, things like these tragedies can happen. And if you think, Mike, that we still don't have clean water for all the children in this nation, it's just simply wrong.
Yeah, I agree with you. Doris. And I'm going to thank you for sharing. And I'm going to use this as an opportunity to introduce you. And I'm just so honored to be joined tonight by Doris Grinspun, who is the CEO of the Registered Nurses Association of Ontario. She's been their CEO for 25 years. And anyone who knows anything about Ontario politics knows what a force of nature Doris is in terms of being such a strong advocate, not only for nurses, but for healthy, sustainable, livable communities. I've always admired Doris and the RNAO's emphasis on not only advocating for a good, solid, robust public healthcare system, but also addressing the social determinants of health, how poverty and housing and a clean environment, clean water, clean air, how important that is to people's health. And I want to especially acknowledge Doris's leadership during the COVID pandemic over the last 16 months. She's been a huge advocate for strong public health measures and also a strong advocate for frontline healthcare workers. And Doris, I just really appreciate you taking the time to join us tonight, because I know how incredibly busy you are right now.
Thank you very much, Mike. And we have enjoyed our relationship with all parties in different ways. And we will talk about the specific, we will talk more than about one today, likely. And with you, Mike, on issues not only related to the environment, for which the Green Party is well known, but actually you have been a keen advocate on issues like the opioid crisis. And you and I did an op-ed piece together, and you visited with us and spoke with both clients as well as staff in one of the sites during Nursing Week. We need to remember that the opioids crisis, people that have substance use, has not only not gone away during COVID, but actually it has become significantly worse. The only thing that did better, Mike, for a little bit was actually the environment. Because
that is true.
There was no flights and no nothing. But
For a
it's,
brief moment.
unfortunately, in the just recovery, that's not going to recover just. It will go back to worse.
Well, let's hope we can have a green and caring recovery. And Doris, thank you for reminding me of the op-ed we wrote together. Was almost exactly this time last year.
That's right.
If I recall. And so I actually thought maybe let's begin. Could you just provide a little bit of a context of how the pandemic has affected nurses in particular, but generally society as a whole? So not only has it made the opioid crisis worse, but it's also exposed some other inequities in our society. And I know RNAO has spoken out very strongly. And so maybe you could just give us a bit of context.
Thank you, Mike. So in very simple and straightforward terms, the pandemic has affected us. We knew it would happen. We just didn't know enough we didn't do enough to prevent it, the most vulnerable populations. So if you speak about racialized communities, of course, they were affected. When you look at wave 3, who was in the ICUs, we know that in wave 1 and 2, also many of the people that were ill, both in the healthcare professionals, where you speak about nursing homes, which was predominantly in wave 1 and 2, and also in terms of the younger people from the factories, etc.
Right.
Those were again people of vulnerable communities. And our fear is that will happen again in wave 4. There is no doubt that if we don't move with mandatory vaccination in a much more significant way for all healthcare workers, all of them in all sectors, in all settings, and with the vaccination passport, and yesterday we cannot do it yesterday, the day is gone, and today is already too late, tomorrow will be too late. And I did say with the premier, I said to him, I will stand any day next to him as long as he's pretty soon, because if it's by the time that the prime minister will come up with the passport, by then our ICUs will be completely full. And my biggest fear, because it's fear, is that we will see kids in ICUs. And just picture that, right? When it's absolutely preventable.
Yeah, Doris, you've alluded to the 3 big asks that the RNAO has been leading, really kind of the first organization to really come out so vocally and strong, calling for mandatory vaccination for all healthcare workers, mandatory vaccination for all educators and teachers, staff in our schools, and vaccine passports or certificates. And I'm
12th,
curious,
June
exactly,
12th.
way back in June. And so I'm curious, have you requested a meeting with the premier on your 3 demands? And have you had that meeting?
So the premier is well aware of it. We spoke on the phone 2 days ago or 3 days ago. The premier knows that any day that he's waiting is a day too long and will cost lives. The premier cannot deny that he knows that. I read in between the lines, or maybe I want to read in between the lines, that something will be coming. But the coming should have been already. But again, you cannot recover lives or time. The premier this week needs to make an announcement. You may or may not know. Well, you likely know because you were invited. So was the premier, by the way, because I got the letter that Steven Del Duca is having a meeting on Monday. I am going to the meeting. I hope you, Mike, are coming to the meeting.
I've already said I'm going. So
beautiful. These are a crisis, right? A crisis cannot be partisan, and the premier needs to be there, Mike. The premier ought to be. Andrea Orbach, the premier, good that you are coming. We all need to be there because this is our collective problem, and we need to move with solutions. And not coming is hiding. For whoever of the political leaders that are not coming, it means they're hiding from the problem and putting like that bird that puts the head in the sun. But this virus doesn't rest. The virus doesn't go to sleep, doesn't take weekends, doesn't take holidays, doesn't go to eat fish and chips or anything like that. What the virus eats is people. It's people. It's people. And it was the older population in wave 1 and 2. It became younger, more younger on wave 3. And now it will be way more younger, because those are the people that are not being vaccinated, whether it's hesitancy or whether it's anti-vaxxers, and I will call them the way they are. For a while, Mike, I was respectful even to anti-vaxxers, and I was answering in a kind way. You know what? You ask me how are nurses doing? They had it.
Yeah.
They had it with people that know that they can take the vaccine, that we are in a country where we are lucky enough to have more vaccine than what we know what to do with, and that still refuse to protect themselves and end up in our ICUs, pushing aside friends and colleagues of us that are sick. I know of some, and their procedures are being delayed because they're occupying those beds. So we resent that. We take care of them, but we resent that. And also costing the system a lot. I'm sorry, Mike, when they could have prevented it. Now is the time to get vaccinated for everybody. Just enough is enough. Enough is enough. The science is there, the knowledge is there. And I also feel embarrassed. I need to tell you, I feel embarrassed when nurses tell me they're not being vaccinated because I don't believe on vaccines, or my body, my choice. You know, I'm a feminist. My body, my choice, absolutely yes. Not for something that is contagious like COVID-19. Because the majority of the healthcare workers, cannot get protected if you that work next to them are not protecting yourself also. So enough is enough.
I appreciate you saying that, Doris. And just so you know, I've said from day one, and will always say this, that I'm ready to work across party lines in a nonpartisan way to address this crisis. And I will be there on Monday, and I hope all 4 party leaders are there, and looking forward to hearing from experts like yourself and others who both have the expertise and the connections with people who are working on the front lines. And I'm curious, Doris, because I've seen this pushback. I've seen your Twitter feed. Unfortunately, you and I have been tagged together in some of that, some pushback from people saying, you know, a vaccine certificate is a violation of my privacy. It's going to create two societies. There's equity issues, there's constitutional issues. And I'm curious how you respond to those kinds of concerns.
Thank you for asking. So first of all, going to a theater or going to a concert is not a must. It's a choice. So if you were one of those people, and what I'm saying to these people is you're choosing not to protect yourself and protect those around you, then you will need to choose not to come to non-essential services. We wouldn't ever deny you from a hospital or from a healthcare provider, or even going to the supermarket to buy food, but from entertainment, from things that are not essential. We all make choices, and that's a choice. And as for the constitutional right, we have spoken with constitutional lawyers. I'm certain the government has, and absolutely they will tell you that that's a red herring. Yes, they may launch a constitutional challenge, they will lose. So let them lose. Enough is enough. I mean, when you look at what's happening in the US, is heartbreaking, is outrageous. And we cannot afford that. We cannot afford this anymore, because there are people with other conditions, not only COVID, that have been waiting for 18 months. Some have been delayed already twice for surgeries. We cannot continue to do that. There are people with cancer, Mike, that are not getting their procedures because of what's starting to happen yet again in our ICUs, because the numbers are going up. And when we start to see children, there is a reason why GPO and Sick Kids and Blue View decided to put mandatory vaccination for all healthcare workers. Because I tell you, we are going to start to see children in ICUs. You put together the Delta put together asthma, and put together everything else that is happening, and look at the US. We don't need to look farther, you know?
And you talked a little bit about the burnout nurses are feeling, and a bit about sort of, I guess, resentment, really, that they're not being able to care for people who need their care. And I've lost friends to cancer in the last year. And sometimes you wonder, you know, did it have to happen or not? Maybe it would have happened otherwise, but who knows if they could have accessed care more easily. And so maybe just, can you elaborate a bit more? Like what are frontline nurses telling you?
Yeah, so first of all, during the first and second wave, there was no vaccine. So it was exhaustion more than resentment in that way, and fear to bring it home, right? Fear to pass it on to a patient, because except of the PPE, and even PPE, we had issues, if you remember. And then it was during last summer when things were getting better, they were going to work, and then everybody outside, like the world was perfect, and then the numbers, of course, started to go up and up and up and up. Now it's more serious because we have less nurses. As you know from the reports, many became ill. And not only we have less nurses, they're more exhausted because it has been nonstop.
Right.
And now they're receiving 95% of the people in those beds are people that are unvaccinated or only partially vaccinated. So that's data they know. So you are taking care of people that had decided, quite as a choice, not to take care of themselves. So of course they will take care of them. Of course they will take care of them. But I don't know if you heard in the US, the situation in some places is so serious that actually they will look at vaccination status first. We never will get to it because despite that, likely some of these anti-vaxxers are also anti-Medicare. I could bet you that. All of a sudden they will love Medicare because Medicare will not leave them on the side, right? So these nurses and doctors and RTs and others are taking care of them, despite that they didn't take care of themselves, and are very exhausted and fearful. As you know, with Delta, you still can catch the virus. You don't die from it, thankfully. You don't die from it, and you likely, the great majority doesn't get into an ICU, but you can become ill. You know what I mean? That's no good. So again, the only solution is for people to get vaccinated like now. There is no even lineups. And because it's not happening, and because we do not believe anymore that this will happen by the goodwill of people. We already reached those people. We even reached most of the people with vaccine hesitancy. People already know if they want to know, Mike. This issue that they have been brainwashed with misinformation, people can get the right information today. Few maybe are vaccine hesitancy. But there is those that are vaccine no, and you don't tell me what to do. Well, then the passport, that's the only thing you can do there.
And Doris, given the sort of unfortunate challenge we're facing right now with Delta, the fact that children under 12 obviously are not eligible for vaccines at this point, we do have a small but very vocal segment of the population who is saying no to the vaccines. Are there other public health measures that you're advocating for that you think are important as we start to combat this fourth wave?
Yes, so in schools, not in schools, but actually there is we didn't call it mandatory ask because we didn't want to confuse. But if you look at the mask, they only ask for mandatory mask for children from first grade to end of high school. But daycare and kindergarten is not mandatory. And we have been saying from the beginning, 2.5 years old and up, and that's where I get the most interesting comments in the media about all kinds of things that I don't want to give it legs through your feed, and I respond to them, right? those children need to wear masks. Most children have no issue with wearing a mask. They have none. It's like tying your shoes. In fact, some like it because it's the DORA and it's the whatever else, right? And the second thing, ventilation. Critical, the issue of ventilation. We were asking already months and months ago. We were asking at the end of school year. We have been asking all along. So now, last month, right, before opening the schools, all of a sudden, fine, we start with the ventilation. That will not be perfect because it's not enough time in our hands.
Right.
And of course, we didn't do the smaller class sizes, which we asked. So we again, you cannot recover time, but why are we wasting now precious time on not doing consistent mandatory vaccination for every single healthcare worker, every single teacher and educator, from daycare all the way to university and anything in between, for every person that works under the payroll of Queen's Park or under the payroll of whatever. All those things can be done like this. And the same people that are now complaining will complain. So nothing new there. So you're not going to have more complainers all of a sudden. And then the passport, because we are choking the business. Michael, I don't want to say the type of food because I'm afraid they will be blasted, because that's what the owner of the little store told me when I went to buy the food. I said, place that we go often with Ricardo to buy, to bring food just to give them business even during COVID. This person is afraid of opening the restaurant because if the person will say by their own volition, show me that you were vaccinated, they will not be only blasted there, they will get horrible reviews. And the person doing the reviews will not say, I'm an anti-vaxxer, will just put horrible reviews. They can drown, they can close your business down. And there are many, we live here in East York, many small businesses that are at the breaking point. The Premier says he's a friend of business. Well, I don't think he is if he's not doing a mandatory vaccination passport that mandates businesses to ask. So it's not on you, Mike, to say, show me, but you are mandated to ask for it. And then you will not get the flag.
Yeah, it's interesting to say that, Doris, because I feel like government having small businesses back is partly putting in some regulations and some requirements like vaccine certificates to take that burden off of business. I remember early in the pandemic, Guelph, Wellington, Dufferin, Guelph was the first local public health unit to have a mandatory mask mandate. And for some businesses, it was such a relief because they were like, we don't have to ask anymore. We're just like, our public health officer said we have to do this. And it took the burden off of business and it de-escalated some of that conflict. And so thank you for really pointing out how important that is.
Speaking about those regions and Kingston, etc., of course, I am happier with Dr. Kieran more than what I was with his predecessor. You know that I called for his predecessor resignation. But I need to tell you that I'm surprised that he's not pushing stronger and speaking stronger on these issues. It tells you, of course, it's better because he didn't reopen the whole thing and there are several measures. But I would like to see him also pushing stronger. So a message for Dr. Kieran Moore, you got to go stronger on the Premier. And I say it also to cabinet ministers. I'm certain, I know some of these people, that many of them are on side with what RNAO is asking. Well, we are not pushing hard enough. Please push hard enough. Ideally, Michael, we don't need the meeting on Monday. Ideally, you don't need to go and I don't need to go, or we simply go to clap and to say how we give it legs, how we give legs to the passport, how we support the decision. There will be time for us to say late or not late. Let's come together. Premier, make this announcement. Tomorrow is Friday, because Monday we are going to be there one way or another. We are either there to say how we support you on the mandate, or you are not going to hear, at least from some of us, very good things, because we are exhausted. It's not only the people, and I'm sure you too, and I'm sure the Premier too, by the way. this is exhausting. This pandemic is exhausting, but fighting to do the right things is exhausting in itself. When you're asking me, how are my colleagues? Their exhaustion is not only from caring for patients nonstop for 18 months. Their exhaustion is not only by being short-staffed, by having their family, at arm's length because they cannot be with the family enough. Their exhaustion is also by going to the street and seeing anti-maskers. Their exhaustion is also by fighting with a colleague, why are you not vaccinated? That is the added burden that we could lift from everybody, including from our businesses.
Doris, I want to ask you a couple more questions because I don't want to take too much of your time because I know how busy you are. But
well, I am with CP24, so I will speak about my meeting with you at CP24.
Perfect. Why is time so important? Sometimes people don't understand why acting fast is so important. Could you maybe explain that?
Yeah. So this virus. So if you remember, at the beginning of COVID. With the classic virus, the original virus. It took, it didn't take a few minutes for you to catch up with this virus. Every time it becomes worse. This Delta virus, enough that you are in a room, 10 minutes with a person, a closed room that doesn't have good ventilation and you both are without a mask, boom. It takes nothing. It takes nothing. And there is the added thing that goes 24/7, right?
Right.
So it grows exponentially. And people say, well, but most people are vaccinated. Yes, but the nominator, the people that are not vaccinated, is still huge.
Right.
It was, last time I looked, last week was 4 million and something. I don't know what is today, but it's a large number. So even if you take the kids out of that, it's still a large number. So the virus goes after them. The role of a virus is not to kill people, Mike. The role of a virus is to get people, is to catch you, because the virus needs to reproduce to survive. So it's to catch you. The virus will catch anybody will catch also vaccinated people.
Right.
If they're not with a mask in a closed place, but that vaccinated person, thankfully, will not end up hopefully in an ICU, will not die. From the percentage, some will, but the great majority, as you have seen in the data, no. But it will catch the others that are not vaccinated, will smile and will go to the next one, will smile and will go to the next one. And out of all that portion, there is a number that will end up in ICUs, a number that will end up dying, even if they ask you the vaccine last minute, right? Too late.
Yeah.
And within those, the tragic piece with the reopening of schools and kids, especially come November when they're more indoors than outdoors, is that it will catch kids, no doubt. 1200, it will catch kids.
So the final question I want to ask you, Doris, I may ask you to wrap up, but you've talked about the exhaustion nurses are facing. And I know when I was meeting with nurses and other healthcare providers, there were human resource shortages prior to COVID, and COVID has only made that worse. And especially with the exhaustion, and also just some nurses have gotten sick from the virus as well.
Many.
How do we address, like, how does the province need to address the shortage of nurses so we can make sure we maintain our healthcare system?
Yeah, so I was talking first of all with one of the ministers yesterday, and I was talking today with the CEO that has issues in their own hospital. And the piece that you are missing in that equation, and all of them were missing, is that the US has a shortage too. Right. And the US is expert in offering the sun, the moon, plus. So not only they're offering to our RNs, because what they're after is registered nurses, RNs, and also they're offering to those that are baccalaureate prepared, because they want to move to more and more, quite frankly, baccalaureate prepared in their acute care hospitals, and we have them ready in a silver plate for them. They're offering them better compensation. They're offering them to move them. They're offering them We will pay for your master's. So here are the three things that I said to everybody we need to do. Number one is compensation. And I'm not saying how much, I am saying get rid of Bill 124. Let the unions for any profession, you will see the same in teaching, let them negotiate the rate. It's not going to be a 10% more. What are people so afraid? Right? This bill was done before the pandemic. It was wrong even then. It's completely wrong now because the US doesn't have that cap. Second, build careers for nurses. Build careers in your institution, in our province. Build careers that the PSW can become an RPN or can become an RN, bridging programs, right? Build careers where you say, you stay with us, we will pay your certification to that end. We will pay your certification for ICU if you stay with us 2 years, right? Build a career so we can't compete on pricing, on pay. We can improve it, but we cannot compete with the US. But we can compete on building good careers for nurses and a better compensation. And the last and most important alongside with that is workloads. No different than anybody else. People want to deliver good care, good work, right? In any business and in nursing, we want to deliver good patient care. You can absolutely handle if even 2 shifts out of your 5 or out of 1 shift out of 3, whatever you're working, is not a perfect shift. Anybody, no work is perfect. But when every single day you're leaving work thinking, I didn't do enough, I left this undone, I didn't respond to this, maybe this patient will die because I didn't do this. Not only you're afraid of your license, your heart sinks. Your mind gets numb. So we need to decrease these workloads because it's impossible to do good care with these workloads. During the wave 3, nurses, RNs in ICUs and critical care, usually they have 1 patient. They were double and triple. I tried to explain this with the media in terms that they can understand. And I said, have you ever read Sartre, or have you ever read Kafka, or any complex book, right? Well, it's like reading 2 of those at the same time and trying to process them at the same time, because if you leave it for a minute, it will drop and you will never be able to read it before, meaning the patient will die and you know what I mean? It's impossible. It's impossible. It's mind-boggling how organizations did that. So when it cannot become the norm, extenders cannot become the norm because it didn't help. And the more you lose RNs, the more you will lose RNs. You know what I mean? Because the worse it gets, the more we live. And the reality is we went to the pandemic being the lowest RN per population in Canada, here in Ontario. Now the numbers came last week from CIHI. We actually are lower than the lowest now. So it's a disaster. It's a crisis. And I have been calling for an HR summit. It's absolutely urgent. And unfortunately, now with all this again problem that we are not moving fast enough with public health measures, it will only get worse. It will only get worse.
Well, Doris, thank you so much for taking the time tonight to speak to our audience, and for those who could join us live and those who I'm sure will watch the feed in the future. And, thank you for being such a fierce advocate for nurses. And just, I want to say again, thank you to all the nurses who have worked so hard and cared for our loved ones. And there's a part of me that wants to say you're all heroes, but I almost feel like that's empty words at this point, that if we don't back it up with compensation and career pathways and workloads that are manageable. Yeah, exactly.
And one more thing, given that you can push in your own platform when the time comes, is nurse practitioners. We have about 70 nurse practitioners in the 640 nursing homes. And those homes did better. Just picture in every home if we had a nurse practitioner. They were there day in and day out, Mike. They were not virtual. They were physically there day in and day out. We need to put a nurse practitioner in every single nursing home, and Commissioner Marrocos said exactly the same in his report. So the time is now.
Great. Well, I was going to ask you if there was anything you wanted to add, Doris, but I think you just did. So thank you again so much for joining us tonight. Good luck on CP24. You're always fantastic when you're in the media, and keep pushing. And hopefully on Monday when I see you, we will be there to celebrate a good decision.
It would be good. And CP24, in case people want to tune in at 8:10. And I promise I will mention you, and I will mention the meeting on Monday too. And I will push the premier again through the media. Thank you.
Thank you, Doris. Have a wonderful evening, and do well on CP24 like you always do.
Thank you so much.
Bye, everyone. Thank you.
Thanks to your team.